Please welcome to the stage Foreign Policy's publisher and CEO, Andrew Solinger.
Hello, everyone. I love that there's fantastic, thank you. Don't clap yet, you haven't heard the discussion. Wonderful that there's a great discussion going on in the room. We promise you'll have time to continue that later on. More folks are coming right now here in this beautiful space hard by the East River, which is also a little challenging to get to. So that's part of the puzzle to get you here. Thank you so much for joining us in person, and I also want to thank our audience joining us virtually to a shared commitment where we're going to talk about global progress on NCDs. So happy to have you here. First off, I want to thank our partner, IFPMA, for working with us on this program. We're so thrilled that once again we're partnering with them here in New York. This is the third time that we've partnered with IFPMA at these key meetings at the UN. The last two were on last year, antimicrobial resistance, of course, and before that on universal health coverage. And they're a great partner of ours and help us to really double down on the importance of global health to FP's mission. Many times folks will ask us, why the focus on global health? It is a global issue. It knows no borders and it requires participation of nations across the world. We, of course, saw examples of that 5 years ago with COVID, and it didn't work out so well. So at FP, we feel it's very important that we maintain that mission. This is the fourth non-communicable disease high-level meeting that's coming up, and it seems like every time this discussion happens, there is an emphasis on fiscal constraints. And this year is not just no exception, it's probably the most stark example of that. And it's going to require some real innovation and multi-sectoral work to overcome that. We need to be savvier than ever on solutions for NCDs, and that's some of what we're going to talk about today. Investment here will only improve health and economies, but also economies around the world. So it's actually very well spent investment. We feel very strongly about that when linked to strong health systems, primary and universal health care. It also, NCDs stretch across the healthcare continuum from preventative care all the way through to palliative. So it's incredibly important. In reading the report actually from the UN, I was really struck by the fact that so many people are impacted by NCDs. Every 2 seconds globally, someone under the age of 70 passes from NCDs. We're going to be doing a little math. We're going to be here for 90 minutes talking about this. 2,700 people are going to pass in that time frame. So this is really important discussion that we're having right now, and I'm very pleased that we're here having it. You'll hear this repeatedly today, that the Secretary General's report showed that we had a policy success on NCDs, but an implementation failure. So what we want to talk about today is how we can change that. We want to hear our speakers talk about what's at stake, what they're willing to put on the line, and what their call of action is going to be to try and make sure that implementation works this time. A couple of housekeeping items. There's a lot of material on your tables. There's, of course, a foreign policy magazine. You must read that if you don't already. And you'll also find some material from IFPMA. Please look at that as well. And a postcard on a shared commitment on this event. There's a QR code that you can zap and you can get to the agenda and bios. Please do that and have a look for where we are. And then at the end, please stick around for drinks. We're going to have a lovely reception outside looking out on the gorgeous East River, and we'll do some more chatting there. So let's get started and begin the discussion. We've got a lot to talk about.
For a conversation on the current and future state of NCDs, please welcome His Excellency Ambassador Olivier Mas, Luxembourg's permanent representative to the United Nations and co-chair of the 4th high-level meeting on NCDs, mental health, and well-being.
Ambassador, thank you so much for joining us. We really appreciate it.
Pleasure to join you for this important event. Very happy to be here.
We're going to talk a little bit about the current state of play of NCDs. We want to talk about the challenge, the importance of the high-level meetings in September, and make sure, as I mentioned, if you heard a few moments ago, that we're taking action, that implementations are taking action. So just to set the stage, as I mentioned, this is the fourth NCD high-level meeting that we're all preparing for with the theme of a program for the next 25 years. The Secretary General's report has called it, these discussions in past, a policy success, but an implementation failure. So what can be done this year to ensure the success of these high-level meetings and make the outcome different?
Yeah, thank you very much, first of all, to IFPMA and also to Foreign Policy for inviting me to participate. I mean, for Luxembourg, I represent Luxembourg at the United Nations. For us, global health in general is a key priority. We are also big supporters of the World Health Organization. When I accepted the job of preparing this high-level meeting together with my colleague, the ambassador of St. Vincent and the Grenadines, it was also because we have the ambition to really make a difference for global health and indeed try to move forward. As you said, it has been a policy success, but the implementation has not been on par. SDG target 3.4 is really lagging behind. I mean, many SDG targets are lagging behind, if we are honest. And the main reason for that is because we are not investing enough. I say we don't invest enough, the governments, but also the whole society has to invest more in NCDs to really make a difference. So we really hope that this year, also by integrating the input from civil society, from the private sector, from NGOs, also from people affected by NCDs, we can really achieve a political document, a political declaration in September that can bring concrete change for people on the ground. And I mean by that mainly, this is affecting, of course, the population in the whole world. But what is really lagging behind is especially in lower and lower middle income countries. Right. There we really have to ensure that we make progress in the future.
Great, thank you for that. The report's recommendations mentioned a couple of ways to focus on this. One was increasing sustainable financing. Another, creating health-promoting environments. Obviously, there's great preventative undertakings that can happen. Investing in primary health care and health system resilience and data and being able to measure results and surveillance. What interventions, from your perspective, understanding you're not a health professional, you're government, not yet, you're getting there. What is the most effective and important from where you sit? What will have the most impact?
I would say we have to focus on all of these. And this, I think you mentioned, this is mentioned also in the report by the UN Secretary General. Yeah. These are his main recommendations. What I've heard so far also through our interactions with a variety of stakeholders is that we should really do more on primary healthcare. Make sure that the NCD's prevention is fully integrated in primary healthcare, and also make sure that primary healthcare with that component is also available more broadly, also to underserved populations. So I think that would be the area where I think we can make most progress. I would also say that this year what is maybe special compared to previous high-level meetings is that we need to focus also more on mental health. For the first time also mental health is now mentioned in the title of the high-level meeting, and it's not by accident. It's really something that is affecting millions of people across the world, especially as we are still recovering from the pandemic. I think there's a huge need to focus more on mental health, especially for the youth, young people. And we have, of course, also the development of social media, and the digitalization that is affecting young people especially. So these are areas where we need to do more than we did in the past.
I think that's a great point, and thanks for raising mental health. You were talking about Luxembourg's position, focus on multilateralism, not just health, and how that's important. Maybe you could talk for a moment about different countries and their perspectives on that. What resonates around NCDs, around mental health, around some of these elements that the Secretary General recommended? What resonates with member states? And in your position, as chair, where are you able to galvanize some spirit and unity?
Yeah, I mean, we need indeed to have all the member states, supporting. We need to have an outcome that is supported, that is agreed by consensus, ideally, which of course will not be easy. I must confess, we are not there yet, and there are many different interests at play. But I think we can achieve a consensus outcome. I would say that there are a few levels. I mean, you said Luxembourg, we are committed multilateralists. So this is also the occasion to show that multilateralism can deliver. It's not the UN as just an empty talking shop, but we actually take decisions that will have real-life impact to improve the health, the well-being of the citizens around the world. So there's this argument. There's also the argument of human rights. I mean, to have a good health should be a human right that is available to all, and all should have access to that right. And the third level, I would say, is the economic argument, showing that if you invest in NCDs, it is actually beneficial for your companies, for your economy. There are a number of figures out there, also in studies by the WHO. If you invest $1 in NCDs, you get a return of at least $7 for the economy, because you have a more healthy population, a more healthy workforce. Estimates say that if you have the right investments in mental health, you could actually add $4.4 trillion to the global economy by 2050. So there is also, I mean, that should be in the interest of us all to create the conditions for stronger economies by working on NCDs and mental health.
Indeed, at FP we talk about human ROI and how focusing on human ROI is a great way to galvanize support and spirit. I love that approach. So let's be more hopeful and talk about September and the meetings that we have coming up. What's a win for you? If you were to wave a magic wand and say, I want to come out of this meeting with these results, what would those results be?
Yeah, the ideal result is that we have indeed a declaration that is adopted by acclamation. So, the whole room clapping and adopting a document. So that's the dream, and we will have to make, what do they say, teamwork makes the dream work. So we really pull together with our colleagues from St. Vincent and the Grenadines really to have an outcome where everybody has contributed and everybody can see that it is a meaningful outcome. So agreement by consensus. You might say this is not high ambition. This should be the norm. But in the last, let's say, few months, we have seen that on many, especially on health issues, there's been a lot of, I would also say, politicization. And we feel also the impact of the geopolitical tensions, even in this field where you would say this is more, this should be more scientific based, this should be a more, let's say, factual discussion. But at the UN, there is always the political factor. So for me, the ideal result is that we have consensus and we have a declaration where you actually have commitments by member states, by the private sector, and that includes, of course, the members of IFPMA. And you have objectives that you can then measure, that there is a kind of accountability. And when we have the next high-level meeting after 2030, we can also measure what we have done in the meantime, and hopefully we will be able to show progress at the meeting that will hopefully show that we have achieved progress through also our efforts this year.
Fantastic. I think that's a great note to end on. took a couple of takeaways there on human ROI. Teamwork makes the dream work. And keeping consistent and at it. You've been doing this for a while now, and seeing some results. So I applaud you. When we all talk about there being rapturous applause after the high-level meeting in September, there should be rapturous applause for you now and getting us there. So thank you so much for all that you do, Ambassador Maes. Please, a round of applause.
Thank you.
Please welcome Diana Gittins, an advocate who will share her lived experience with an NCD, and our moderator, Foreign Policy's Allison Carlson.
Hello, everyone here in the room and those who are joining us online. Just absolutely thrilled to see you all here this evening and to be able to have the conversation with you, Diana. We were just talking backstage about how important it is to bring personal experience and human voices to this conversation, and also to the table where decisions are being made. And so, the reports that are on your table have very important statistics and quite a bit of data, and that is absolutely vital. But there are human beings and people's experience behind those numbers. And so, first of all, Diana, I'd like to first thank you for being here with us and having the courage to share your experience with all of us, and how that can inform and help to shape policies and also funding and investment to fight NCDs. And so if we could dive in very directly to your experience, if you could share what it was like for you when you received your cervical cancer diagnosis and embarking on the treatment journey. What was that like for you?
So thank you for having me. In 2011, when I was diagnosed with cervical cancer, I had no idea that, in my mind, I was young, I was 28. And the only persons I saw on television were the elderly people advertising, saying, cancer treatment of America. And we saw that in the ads. And so my diagnosis was a shock to me. And I did not know what my next steps were. Neither did my doctor. He made a referral. I couldn't access care then. And so navigation became an important part, like understanding where I needed to go and what I needed to do next. And so if you understand the Caribbean space, it's small countries or small islands, and so I needed to access treatment outside of my island because it was not available there. The only way I was able to get information is because I knew someone who was a medical professional, and they helped me to navigate the healthcare system. And I found that even when I got to, and I accessed treatment, I lived in Dominica, but I accessed treatment in Guyana. And even when I got to Guyana, to be able to access the treatment, I didn't know which hospital I had to go to. And even when I got to the hospital to get to the unit, and so it required a lot, like 80% of my challenges were how and where do I access the services. Of course, when I was diagnosed, I had no cash, and miraculously, I got a loan from a bank. I don't know how that happened because I was already at stage 3B cervical cancer. And so beyond navigation, I think the next step was, where do I get money for treatment? And it was a blessing that Guyana had systems in place, and that persons who could not afford treatment, they could have access to services through the government. And once again, to be able to access that service, I spent days heading to the office trying to access treatment. I'm glad to say it's much easier now, but back then, it was a challenge, but we needed to advocate. We realized as patients, we needed to band together and advocate on behalf of each other, and that's how we were able to complete treatment in time.
So often we hear these challenges about access and also high cost of treatment. And so when you think about your experience and some of the insights that you've had reflecting on that, and being here in New York and communicating not only with those in the audience, but those down the street at the UN, what are some of the insights from your experience can you share that would inform some of their decision making?
I realized that a lot of times, a lot of the treatment options presented to us, I was not presented with all the different options that I needed to make an informed choice. I was just presented with what was on the table or available in my country at that time, with no consideration as to, and to be clear on this, was one of the issues for me was I able to have children afterwards? And we did not have that discussion. So I think now when I do advocacy and I interact with persons who are diagnosed with cervical cancer, I share that. However, for many persons, the medical professionals, the ministers, they don't think that that our fertility would be an issue. And so I'm saying that to say that our concerns, like my concerns, can only be shared, you can only know them if you ask me. And if I'm here in the space with you, if I'm allowed to share those concerns and those issues with you. The challenges that we face, the successes, because from time to time we experience success, small successes that I think would impact where we apply funding or where we'd like to see funding go. And if I'm not here in the space, sharing my experiences, sharing what my successes were, what I enjoyed about my journey, and being the voice, not only my voice, but remember, we also interact as persons with lived experiences, we interact with each other. Sharing that combined voice and sharing, how do you know if we're not in the space?
I'd like to pick up on that advocacy piece a bit. How have you been working with our views, our voices, and others who may not have the courage yet to speak out, but how have you been working alongside others who have been living with or are survivors of various NCDs, and what have been the benefits and impacts that you've seen from that?
I know you see the smile on my face. And we spoke backstage. When I started this journey and I looked at people like you and you and you in the room, I'm like, what do I have to say? I don't have a medical background. Like, what do I say? And I hear terms that I'm not familiar with. I'd be like Googling in the room, like, what is this? And really, I really had imposter syndrome. And I started my journey with the Healthy Caribbean Coalition, and they provided support every step of the way. And then I started doing work with the Our Views, Our Voices, and we did an excellent training that we definitely have replicated. One in which we were able to, first of all, connect with our brothers and sisters across the globe, right? I still have friends in Africa who we communicate with, where we learn to tell our stories in such a way that it's impactful, that it is no longer just one person, but a community of people with shared lived experiences, whether it's diabetes, hypertension, our challenges remain the same. And so we had series of capacity building workshops, and being exposed to these kinds of situations continue to embolden us and continue to provide us with the skill set that we need to be able to effectively advocate for what we'd like to have. And I'd like to do a huge shout out to the NCD Alliance and the Our Views, Our Voices, people who are seated right here for the opportunities that they've provided me with. And also just being able to enhance the skill set that I have. And I was telling you recently, with the Our Views, Our Voices session, we haven't had one in years. And I remember a colleague of mine telling me today, Diana, we need to have another session like this, but we don't have the funds. And we'll talk about that later, I'm sure.
Exactly. So I'd love to talk about the funding and also how you connect the dots, right? And so you're working with so many of your colleagues, your peers, and developing this kind of advocacy. How do you then connect those dots? And why is it so important from your perspective to be at that table, at the decision-making table, and to be in the room?
It's been, so connecting the dots, first of all, requires a series of interactions. So for me, it started off with grassroots, just kind of going out and picking up the experiences there, doing additional research, and then our interactions here with the different stakeholders in the room, where they share information, and then you're able to now see where your priorities or where my priorities as an advocate, where it aligns. And then you're able to identify gaps. So then I'm thinking of this in this way, and then my vision or it's just impacted by some other view that I pick from some other professional or expert in the room. And so as you go along and the continued interactions, sustained interactions with people within the space, you're able to now better understand what is happening in the space, and you become a stronger advocate, not only for you, but also for your community.
And so in the few minutes that we have left, I'm curious, looking ahead into September, what do you want those who are at the high-level meetings and with you here really to hear and to prioritize? And from your perspective, what will make this high-level meeting on NCDs different?
Community engagement. Being able, exactly what is happening now. We as persons with lived experiences, we have been working with the NCD Alliance, with the support through the workshop, to engage with our missions. And it has been eye-opening. Understanding the process was, it was a next level experience, because many times you don't know. It was eye-opening in the sense I was like, oh, this is where the life decisions are made. These are the decisions that impact my life from the global level. So initially it was my doctor, then the ministry, then the region, and I'm like, oh, so it's global now. So then I feel as if I've had an impact. And so I'd like more persons from my community. I'm a cervical cancer survivor, and yes, I advocate for diabetes, hypertension, but I'd like to have more persons from my community, mental health included, to be here, to have a space where they can also learn, where they're also able to advocate on their own behalf or the behalf of their community. And I think that if given the opportunity for us to be able to speak to more of us, because it's only a few of us, more of us are allowed to be in that space, we'd appreciate that.
Very well said. And I think this is the environment, and going forward as well, tomorrow and beyond, to interact and to engage with you and others in the room who are from industry, from policy, and others. It will absolutely take your voice to inform those decisions that are being made here in this room and definitely down the road. So thank you for being here, and thank you so much for sharing your experience with us.
Thank you for having me.
Next, please welcome John Farrist, Global Health Unit Head of Sanofi, Tisha Boatman, the Executive Vice President for External Affairs and Healthcare Access at Siemens Healthineers, Caroline Mendy, the Director of Global Policy at Roche Pharma, Ambassador Tara Sumru, UK's Ambassador to the UN Economic and Social Council, and moderator Maggie Lake, founder of Maggie Lake Media, for a conversation about unlocking accessible innovations in NCD care.
Well, hi, everyone. It's wonderful to be here and see a packed room, and hello to everyone joining us online. I'm super excited to have this conversation, which we're going to talk about innovations, because I think that we all know and sense that technology has the ability to change Diana's story, right? And create an environment where she doesn't have to have that experience, and that's the end of that chapter. So thrilled to have this distinguished panel with us to talk a little bit about how we can sort of use what's happening in innovation and technology to unlock not only treatments, but access, which I think is really tied to the implementation challenge that everyone has talked about so far. So welcome, everyone. Thanks for being with us. John, I'd love you to kick off for us and talk a little bit about how the pharmaceutical industry is evolving now that we have targeted and tech prevention and treatments. What's happening from an industry level?
So it's great to be here, everybody. It's always difficult to go first, or you're not repeating everybody else, so that's quite a good start, I suppose. I think from an industry perspective, I had Sanofi's Global Health Unit, which we've been going now. This is our fourth year, and I think one of the things that we're well aware of, and the ambassador touched this at the very beginning, is that we want to do more at grassroots level, at primary healthcare level, which means the industry has to play a very significant role in training and capability building at quite often a basic level around NCDs. Because without this, we're not starting at the beginning of the problem. And I think that's something the industry has certainly come together with. We're working on several projects. I can give you an example in Tanzania where there are 5 or 6 companies have come together now, and we're really focusing on when you're going to train a community healthcare worker, you want to train them as many capabilities as possible right across the NCD spectrum. And this is very, very valuable because it allows the patient to be treated where they live rather than having to travel long distances or not even be able to travel long distances. I think this starts before you even think about any interventions, because everybody talks about drug prices and how we need to do that. And yes, that's an area we have to work on. We have to look at affordability, and we have to look at how do we manage to make sure that as much of all of our portfolios are available as possible at cost-effective prices. But if we don't have the capabilities to prevent and manage diseases in the first place, then the interventions are lost. And actually, they can be wasted. And we've seen examples of that. So I think from a supply chain perspective as well, one of the things that we find particularly in Africa is it doesn't matter what price you start with a drug, the costs that get built on that by 10, 15, 20 middlemen in the middle is really, really difficult. And this is where we've got to look at how do we manage that supply chain piece as an industry, how can we come together and make sure that the patient gets the real value that we're looking for in the end.
Well,
Then, of course, just the final piece is it's partnerships. It really is about partnerships. You have to have a government who's interested in building sustainable healthcare. You have to have partners on the ground who can implement the training. And then you have to make sure it's sustainable in the future when your projects are finished.
and this is, I think that last line just explained why it's a complicated supply chain and probably why we have so much friction and why implementation has been hard. But this is where technology comes in, AI. Tish, talk to me a little bit about the role that's playing. I just did an event at a procurement congress with a bunch of supply chain heads at companies, and AI is everywhere, and it's making huge changes. I've got to think there's some positive momentum there. How is that changing the diagnostics and some of the friction that John just talked about?
Yeah, I mean, thank you very much, first of all, for having me. I had, as was mentioned, Government Affairs and Healthcare Access in Siemens Healthineers. You know, one of the biggest roles that AI can play is to take that large funnel of patients that require screening. NCDs are a very specific type of diseases where with cancer, with cardiovascular disease, you absolutely have a significant chance of both saving lives, extending life, and saving cost to a health system by early detection, right? When you look at, I'll just focus on breast cancer for a second. I mean, breast cancer, I'm a breast cancer survivor myself. The way breast cancer has really evolved in the Western countries over the last 30 years, we have extended life by 5, 10, 15 years on average. And some of that is medicines, and some of that is better treatment protocols and better follow-up. But the single biggest contributor to extending lives in breast cancer has been early detection. It's been the fact that many countries have implemented well-planned and well-resourced screening programs. Unfortunately, in low and middle-income countries, this is not the case, right? Over 50% of the women in the world don't have access to breast cancer screening these days, despite the fact that it's the #1 cancer killer of women. But really, where can AI play a role? Well, a mammography screen, first of all, you don't need mammography to screen, right? I'm not going to sit here and tell you you have to have mammography. I found my own cancer with a self-exam, right? So I'm a big believer in training your primary care and your community health workers to educate people, to break down that stigma, and to teach women to do a self-exam or to make sure those self-exams are done in annual checks. But when you go for diagnosis, you generally need mammography. And with a mammo system, that's a very difficult scan to read. So you talk about health systems that lack the right equipment, and then they lack the right people and skilled staff to read those exams correctly. AI has made huge breakthroughs in mammography. We're running programs in Vietnam, in Indonesia, really training the algorithm for the dense breasts, because let's be very clear here, AI also can have a very strong bias, right? And not all women's bodies are the same around the world. But AI in breast cancer and other types of cancer has been a huge topic in really bringing that diagnostic, and also dealing with this skilled workforce topic that John brought up. I mean, you still need a radiologist, you need these doctors who can certify, but if AI can narrow the funnel of cases the doctor needs to look at, it's a huge improvement, and it really can be applied across all kinds of cancers.
Yeah, Caroline, I see you nodding your head to all of this. You know, weigh in and talk about that end-to-end piece of it, because even with Diana's story, she was diagnosed and yet the treatment was so far removed, even you know, through having to go to a different country. So talk to me about maybe the requirements, but also what opportunities might be there.
Yes, completely. I think for me, what is very important, and then it's very music to my ear, to have references to several components that are very anchored on the way Roche is working. In having both the diagnostics and the therapeutics under the same roof, as we are developing our programs and our access programs and our partnership, we're making sure that we have that integrated approach. And then that's really what John and Tisha has mentioned. The opportunity here is, as was mentioned, is really to be more efficient, to really help the healthcare system to catch the diseases early on, really having that full integrations of screening, early diagnosis, and early treatment. And this to really increase the chances of patients to have better health outcome, but also to have lower costs for the patients and for the healthcare system. So this is really a critical approach that we would like to be embraced more globally and hopefully being reflected in these upcoming renewed commitments on NCDs.
Ambassador,
You can call me
Tara.
Tara.
Thank you, Tara. We just, I think everyone's touched on, and everyone in this room certainly knows, but we heard John mention, you can have fantastic plans, and the private sector can be doing what it believes is best policy, but it doesn't matter unless there's a governmental policy to support that. What needs to be done in that area? What would you like to see happen at these meetings that can help marry that?
So I think John mentioned partnerships, and that feels really key to this. So I don't think any entity in isolation is able to see through the innovation that we need to see in this space. So I think it has to be a sort of across-the-piece effort. And I think particularly given the demographic changes we're seeing now, and what's happening in the technology space, Tishy gave some great examples of the benefits and the advantages. So we definitely want to harness this. And I think from a UK perspective, we're certainly looking at the safe, ethical, effective application of these technologies and innovations. And we're looking at how do we utilize them to support the sort of three main shifts that we want to take place in the UK's health space, and that's around moving away from hospitals towards communities, moving from analog to digital, moving from treatment to prevention, and I think technology can help across the piece. But ultimately, as you mentioned, Maggie, there's a sort of broader kind of regulatory environment, there's the enabling environment that I think governments have a big role to play. And I think that's actually why this high-level meeting is coming at a really good time, because I think it facilitates that conversation that involves a wide set of players and actors, both those member states at the UN, but also the wider actors involved in this space. And I think that conversation and that dialogue that will hopefully get us to a point of sort of consensus and a document that we can all agree on will provide a bit of a set of parameters and guidelines to help us all utilize these technologies to tackle NCDs and mental health more effectively.
Tish, I saw you nodding vigorously when she said from hospitals to community. Why is that so important?
I mean, a health system is a full ecosystem, right? And even if you look at the pandemic and we think, okay, it's one particular disease and we resolve it with a vaccine eventually, right? But there's a whole complicated health system behind that, right? And so the topic of health system strengthening and looking across is, yes, it's laboratory equipment, it's different types of radiology or treatment equipment, but it's also very much built on people and the whole thing working together. So the funding piece comes in there, whether it's partial government funding, partial private funding, but also, I think Diane said it very well, patient navigation is a huge topic. And this is one thing that's a little bit different with non-communicable diseases, right? This is not your communicable disease screen and treat. I don't want to oversimplify, but we do have a tendency around the world. We look at what's happened in HIV, we look at what's happened in other diseases, and that's a single disease approach, which has been tremendously effective, taking nothing away from that. But non-communicable diseases really require a full ecosystem, right? It's a health system. Each screening might be similar, but each patient pathway is different, depending on the different things that happen to them. So this is where I think it really requires building a system, and those partnerships are necessary, but really understanding a full pathway. And there's no one entity, be it a government, be it a private sector, be it a non-governmental organization, that really can cover the whole pathway alone. So really building this in this ecosystem is super important.
Well, I think you just laid out why perhaps implementation has been so hard, in addition to the funding, which we will get to and we know, but there are so many each journey is unique. There's so many parts of this that have to work together. John and Caroline, I'd like to hear from both of you. John, what do you think is the biggest barrier? I mean, when you have to fix a lot of things and it needs to seamlessly work together, sometimes it can paralyze or you can't focus on what to start with.
Yeah, I think you mentioned almost the patient journey, and I think we get that gets overcomplicated, and we don't learn from some of the great work. Many of you have been involved in the amazing work that's been done with HIV, and I think we can go back and use some of that to also look at how do we manage NCDs in remote areas and use the learnings from that. It's really, really important. We have to work closely with agencies around regulatory process as well. One of the biggest barriers of innovation and speed of access, particularly for medicines, is regulatory process. It's very, very complex. You know, I have 40 products that we have from an impact brand from Sanofi. It's taken me 3 years to get some of these registered in countries in Africa. And it's only because they want to start from the very beginning. It's the same product with a different box coming from the same production line. But we have to help people to understand how to overcome these areas. The other piece, and I want to go back to the digital AI piece, we've got to find a way of collecting patient data and collecting that patient data along the continuum. And how do we use smartphones? How do we use AI technology to not repeat tests and not repeat information gathering for patients? We should be able to capture that at remote areas now, and as developed partners, we should be doing that to help them understand that a patient needs to be managed and that their data is really, really important from day one. And we don't have to repeat tests, and we can use AI to follow that.
Yeah, that's going to be really important. And, you know, you just mentioned that, Caroline. I think when people, you know, from the outside, and this may be policymakers and some, we talk about innovation in the medical field, we're used to thinking about breakthroughs in treating diseases and some of the lab research, but innovations and harnessing tech can be in many different areas when it comes to access. That maybe needs to be part of the holistic conversation.
Completely, and really innovation goes beyond, you know, bringing breakthrough or life-changing medicines, devices, and therapeutics. It's also the way we can reimagine the healthcare system with governments and stakeholders, so the healthcare system is more adapted, and then we move away from having healthcare systems that are reactive to healthcare systems that are more proactive. So I think this is really a mindset that needs to happen, and all stakeholders need to actually sit together to actually have that reflection. And you were mentioning earlier this impression sometimes of being paralyzed. There's so much to do, and then it can be perceived as a daunting task. Addressing the NCDs is huge, and then it can be perceived as unachievable. But actually, there are significant examples that have already been developed on the ground that the industry and many stakeholders have contributed to. And I think maybe it's about time to also learn from those examples. There's no need to restart everything from scratch, but maybe to think about how those existing examples, mechanisms, partnerships, ways of delivering the care where patients are really getting closer to the patients through remote systems, through new formulations when it comes, for example, to pharmaceutical industry developing new formulations, or monitoring devices, or self-tests, all those systems that can alleviate the healthcare system, that can bring the care closer to their home, if it is where it is more convenient to them, that's going to really release a bit of the pressure of the healthcare system. So all these mechanisms exist. I think at this point of time, it's really how we can scale up what has proven to work. And it's really about to have that conversation of how can we leverage those best practices to make sure that we're not restarting from scratch. There are certainly some new ideas that can come and then that will continue to improve what we're all trying to achieve. But there are already a wealth of excellent examples that have been impactful, and then we can capitalize on those ones.
Yeah. Tara, would you like to pick up on that? I mean, we keep hearing over and over again, we know this isn't possible without partnership, and yet.
Yeah, I mean, I was going to actually pick up on a few of your points, Caroline, because I think the fact that, you know, we need to move away from a reactive approach is absolutely right, and I think for NCDs, it is so relevant because there is so much that you can do in a sort of preventative way related to lifestyle and health choices. And I think, that is very much from a UK perspective, given funding for the NHS is something that we talk a lot about domestically being a problem. How do you address that? It's by reducing the amount of in-hospital care that patients need to receive and preventing people from getting to that point. So really that is a lot around lifestyle sort of choices, and that is where wearable technologies are really important, and where I think we use continuous glucose monitors as well to help build that data picture, John, that you were talking about, but help people manage their own experience and their own treatment. But I guess on the point about partnerships, Maggie, from a UK perspective, we're investing a lot in research, and some of that is done with private sector partners as well. And I think we recently announced a sort of 82 million package worth of research, which includes support from the private sector. And really what comes out of this research that's looking at, how do you do more early diagnosis of cancer? How do you do more on early diagnosing various different aspects also related to NCDs? And that research is not just something that will benefit the UK, but should be widely applicable, globally beneficial. And I think that's the benefit where, where countries like the UK are investing heavily in tackling NCDs. All of these approaches should be relevant across the piece.
And that sharing information we know is possible based on what we went through with COVID. I mean, that showed that things can be done differently. And so trying to pull that into an area like NCDs, the expectation is that that's what should happen, but we need to get there. I'd love to hear from Tish and John examples of partnerships that you think are working, that you have found successful, that might be an example for others to base their work on.
Sure. I mean, I'd love to give some credit to the Egyptian government who created the space for some very effective partnership work around breast cancer. So about a year and a half ago or so, Egypt declared that Egyptian health is women's health, basically saying that if we don't address women's health, and they've started a comprehensive breast cancer screening program across the country for the 30 million women in Egypt, 30 million plus who previously didn't have access. And they created the conditions by which, they did things like saying, well, okay, here's the data on where we have equipment and where we don't. Here's the data on where we have, we're sharing the information about where we have trained staff. Different industry players have come in to support that. I do believe Roche is involved. From a Siemens perspective, we're providing some mammography units, but what's really important about the Egyptian case is you have also academia, in our case it's Cairo University who we're working with, to train clinicians across the country. And what we do is we go and we train in these training camps a week long, staff in their own environment, rather than pulling them into Cairo and training them in an environment, in a space that's not where they normally work at. We train them in their own hospital in a camp rotating across the country. It's enabled about 300 more clinicians to be ready to read mammography and support women through that pathway per year, and that will keep going for the next couple of years. There's many players, but the government really set the framework that allows us all to work in that space, also bringing in academia, and I think it's a great commitment and a great example.
So I really go back to, I mentioned Tanzania a few minutes ago, but the ambassador's comment at the beginning as well was a really interesting one, because we sat down as 5 pharma companies with the Ministry of Health for a full day in Tanzania and looked at their strategic healthcare plan, which was very sophisticated and very detailed up to 2030, with targets. And what was most interesting was they had a funding amount that they were called investing rather than spending on healthcare. And I think this mind shift of investing in healthcare rather than spending on it is the big turning point, because once you've got that commitment, it makes a difference. Then the best bit around that has been also that we've had great NGOs on the ground who are able to work directly and really well and with very skilled and efficiently in the remote areas. And again, the data collection using AI, using smartphones, using technology to actually screen, and I think many of us have mentioned screening, because screening and prevention at the beginning is just as important, and that can save a lot of resources. But the government had a plan and a target of number of community healthcare workers they wanted to get to. And it was pretty ambitious, from a number around 5,000 or 6,000 up to over 40,000 in the 2 or 3 year period. And they knew they couldn't do it on their own. So it almost forced the partnership, and it forced the piece that we had to all work together. And the interesting discussion was, how are you going to sustain this afterwards once all the training's been done? And how are you going to pay people who perhaps weren't even paid in the past to deliver healthcare? And this, again, was a really almost a business plan and a proper structured plan around health that makes you realize that when you do something, it's going to make a difference and it's going to be a continuum. And this is where we're able to have a broad reach across many NCDs. It's interesting sitting on this table, you know, you have different companies with different skill sets and different NCDs that we all focus on. And this, again, was bringing a group to the table that was able to train a community healthcare worker across a broad spectrum in one go. And this is, I think, really, really valuable from a sustainability point of view. And that's, I think, a gold standard of something that will really work. But it starts from that commitment really at the country level to invest in a sustainable model.
Go ahead, Tisha, before I get to
Yeah, I mean, I want to double underline that, right? This topic of investing in health and the fundamental of a community, to have a thriving community, to have continuous job creation, to have continuous economic growth, is a healthy community, right? If people cannot work, people cannot go to school and learn if they are not having some fundamental levels of health. And no matter how you do the business case, it always works out. But it takes a big momentum to start, right? This is not a small task to take forward. And I think this, you know, it was said before, but healthcare as a human right. I mean, healthcare is the foundation. Solid healthcare is the foundation of healthy communities. And remember what John just said about those community health workers. That's 40,000 jobs in that country, now paid jobs in Tanzania that didn't exist before. That creates additional economic growth. I mean, of course, the patient piece of it is absolutely critical, but sometimes we also have to turn around and also look at the business side of it, and it makes good sense for governments to invest, for entities to invest in their communities in healthcare.
And Caroline, to me, it sounds like you just mentioned before, health systems need to be proactive, less reactive, more proactive. In a way, so does the planning around this. I mean, the example you're giving, John, sounds like something that enables governments and partners to scale. I mean, that must be the key. Do you see that happening in the work that you're doing? And can these blueprints be something that's scaled and be something that pulls into the high-level meetings?
So we do see this already happening, but unfortunately it's not at the scale we would like and at the pace we would like. So this is really where I would reiterate my earlier point. We could save so much time in actually learning on what we have observed and that has been proven to really work. And then we have just renewed last year a partnership that was rewarded in a sense that it was showing kind of best practice on how to engage, how to plan those partnerships in a sustainable manner. In Côte d'Ivoire, that is focusing on breast cancer. And this is an initiative that we launched back in 2014, and that is renewed towards 2029, if I'm not mistaken. But just to show that there are examples, and then that would be the example that I'm mentioning is only the one from Roche, but then there are certainly plenty of other examples from the pharmaceutical industry and also other stakeholders. So this is really where it's about time to really capitalize on that, gather all this experience, and also save some time. John was mentioning those conversations that he was having with Tanzanian government. This is the conversations we're also having with the governments we are working with on the ground in every country we're operating. And Roche is operating in 130 countries. So I'll let you imagine all the conversations that is happening. We have a wealth of learning that we can share. So as we are sitting for entering in new conversations with another country, we can capitalize on what we learned from somewhere else. So I think this is really, for me, the strongest message is rather than describing an initiative that happened here and there is what we learned from there. What did work, what didn't. And then as we are embarking into another journey in another country, probably with the same type of issues, perhaps not necessarily the same magnitude, but can we actually use what we learned already?
Absolutely. So let's end with you, Tara, and what's your call to action as we approach this meeting in September? Of course, there's a hearing tomorrow, but in September, what needs to happen to help not only move policy forward, but that really important implementation part?
Yeah, I mean, we're facing a difficult backdrop to the meeting, the NCD and mental health high-level meeting, but a whole variety of other high-level meetings that will take place during the General Assembly week. And so I think, building on the ambassador's points earlier, there's a point around just global partnerships, that is member states working together to recognize common challenges that they are facing and understanding the need to share lessons, recognizing the role that wider actors have to play in this environment, that governments can't do it on their own. We're in an environment where there is much less development assistance in this space, and that requires a real partnership approach. And I think, Caroline, it's, I liked your point about, sharing what works, but it's also really what doesn't work, because often you find countries making similar mistakes, and we have to try and learn from that and avoid that. But, I think this is an opportunity. Last time round we had this conversation, I think it was in 2018. A lot has changed since then. So I think we really have to take advantage of this moment and this, where we are in this time period, and try and build the global sort of consensus around these issues and how to tackle them.
Especially at a time when we have technology as a tailwind to help to achieve some of what you all talked about.
Absolutely, and to scale, I think, to help scale some of the solutions and help make them affordable and accessible, right? Because the initial upfront costs might be higher for some countries that are investing in this, but as you replicate that elsewhere, the costs should come down, and that's where I think the investment that we put into this really pays off.
Fantastic. Fantastic conversation. Thank you all so much for sharing all these wonderful examples. Thank you.
Thank you.
And follow me out this way.
Next, Shashank Deshpande, the head of Human Pharma and chairman designate of Boehringer Ingelheim, will discuss the importance of collaboration with Foreign Policy's Alison Carlson.
Great. Thank you so much for joining us today. And I'd really love to pick up on the conversations that have been had thus far. And we just heard a great discussion about innovation and partnerships. But I'd like to dive into some concrete examples about how we can address what is obviously a very broad, encompassing challenge across many disease areas. How, from your perspective, should we start thinking about this a little bit more holistically, and what can be done to really drive impact and build on all the work that's been done to date, but do so in a more streamlined, more efficient way?
So thanks for having me, first of all, Alison, and good afternoon to everyone. We've been thinking a lot, and I love what the previous speakers have said, because there's a lot of themes here: enabling primary care, looking at the entire spectrum of NCDs, and I think where we are maybe, or where we've fallen short over the years is, yes, we treat a lot of the elements. We've looked at hypertension, we've looked at diabetes. As humanity, we've sort of done this sequentially. And how do we really get to a place where we can say they're interconnected? Because science has been telling us for years now that these conditions are interconnected, and yet they're not being discussed at the patient level, at primary care level, really as an interconnected. I'll give you an example, and I think that's really made the difference for me. You have chronic kidney disease, and we immediately link CKD with end-stage kidney disease and dialysis. But it's actually you're 20 times more likely to die of cardiovascular disease if you have CKD. And so I would ask all of you, actually, when you visit your primary care doctor, how often do you discuss the kidney? Same thing with your liver. So the interconnectedness of the organs, and how do we set up the system to recognize that the biggest bulk of the cardiorenal metabolic diseases, I mean, they constitute the biggest part of the NCDs. How do we tackle this, not sequentially over decades, but how do we discuss this really as one? How do we enable, and it was said before, how do we enable primary care to treat to treat CRM holistically, really.
I'd like to ask you that question, right back at you. So
Yeah.
when you think about one of the primary challenges being primary care, and that not being strong at a local level in some instances, and barriers to access, but then also not having a holistic approach by healthcare providers, in your perspective and in the work you're doing, how can that be overcome in a concrete way?
Yeah, and I think that's where this the topic of partnerships really comes in, right? There is no entity that covers from education to diagnosis to screening, diagnosis, treatment, and maybe that's where we all get lost a little bit to say, oh, it's so big, it's hard to break it down, but it's actually not. When you look at it at primary care level, how do we get the right players together? And we have partnerships with the NCD Alliance to look at how do we create advocacy around this topic? How do we create education around this topic? Enabling primary care really to have that conversation. And I think that's really, and I've talked a lot about maybe cardiovascular, cardiorenal metabolism, but mental health is even more important that we start having this conversation at a broad level, holistically, but also in primary care, because how do you get away from the stigma?
Can we dive into that a little bit more? I think we've been talking about quite a number of disease areas. We haven't talked about mental health as much, and I'm curious, in the work you've been doing in Boehringer Ingelheim over the years, how are you focusing on that now, and what does need to be prioritized, and the partnerships that need to be formed to break the stigma?
Yeah, I think any number you look at or that you have in mental health is probably wrong, because we can say there's about a billion people affected by mental health, and the truth is the numbers are probably underreported. When we look at how, as a pharmaceutical company, how do we approach this from a scientific perspective? How do we, where's the unmet need? We've seen over the years a lot of entities, governments, societies talk about well-being, but when we talk about serious mental disease, there's still a huge amount of stigma associated. And we've seen, as we engage with partners, such as the WHO Foundation, this is I think the ambassador mentioned, a huge economic impact that mental disease causes, serious mental disease causes for sure. And here again, partnerships, education, but also, quite frankly, as a society, how do we allocate the funds? Because it will, I think there's only 2% of any healthcare budget is allocated to mental health disease, and that's not enough when we compare, for example, to oncology, when we compare to other diseases. This is something we need to tackle, again, as a society. We can play a part. We can research and develop. We can partner, obviously, but there's a lot more that needs to be done.
I'd like to come back to the financing piece in just a moment, but with respect to mental health, and you mentioned your partnership with the WHO Foundation, what are you working on with them specifically? And can you give us some concrete examples of how that partnership is working? I think it's really important to kind of put a fine point on those things where there are distinct but really complementary both skills and resources, capabilities among different organizations. And I'm curious if you could shine a light on an example there.
Yeah, I think where we as a pharmaceutical company, we're very connected with the science, with academia, with key opinion leaders, thought leaders on the field. Our job is to really push the science, to look at how can we serve what we can do with our research, but then also with the WHO Foundation, how do we link the public awareness? How do we link the advocacy? How do we link with governments to really elevate the conversation to allocate the funds needed? I think a lot of governments have nowadays a pretty good I'd say there is a strategy, but how do we enable it? How do we really track progress? There, it's then not so clear anymore, I think.
So when you think about opportunities such as this gathering here, the multi-stakeholder convenings tomorrow, and kind of that roadmap to the high-level meetings in September, and definitely beyond as far as implementation is concerned, for you, what would you like to see specifically coming out of these meetings in concrete terms as they relate to financing or other elements, but something that is concrete that you feel will materially move the dial and have impact going forward?
Yeah, I'd say on one hand, when I look at really being more specific, even more specific, we know we have a role to play as pharmaceutical industry, but so do governments, so do clinical and medical societies. Bringing the stakeholders together, we will do our part, I think, as an industry, but this is, I think it was mentioned in the beginning, going from, we've been great on policy, I think was said, but not so great on execution. At the same time, we have seen over the last years, also in COVID, great execution. And how do we bring this together? I think that's really the challenge and the wish. And being specific on NCDs, seeing the interconnectedness of the diseases and tackling them together, I think that would be my wish, what we need to do here.
Are there a few lessons that were learned during COVID from your perspective? And when you think about catalyzing action to drive impact on what is a very urgent and global challenge, what could some of those lessons learned be? I think about implementation and how important it is in an environment of scarce resources, right? Where you need to really mobilize quickly, utilize scarce resources, and prioritize on those actions that are going to have the greatest impact. Are there lessons to be learned that can be applied here?
I mean, surely, I think we all saw the threat. We had the sense of urgency. There were no boundaries, no taboos in terms of exchanging on science. And I think these are all good lessons, but we haven't, as a global society, really applied them to NCDs, to mental health. So we take a virus more seriously, potentially, than something that's killing far more people than COVID probably ever has or ever will.
So what will it take to raise not only the awareness, but the ambition in the same respect or to the same capacity?
This is what I hope we get out of the fourth meeting now, this sense of urgency. I don't think there's a shortage of ideas. I don't think there's a shortage of what we need to do, but we do need to do it. And how do we get, so many things come together, but I do believe the recipe is there to make a dent, and it's not just a dent, a significant change in the trajectory of NCDs and mental health.
Thank you. Thank you for your perspective and your work, and wish you the best, and as well as everyone else in this room in that effort. So thank you.
Thank you very much. Thank you.
And now, please welcome Katie Dane, the CEO of the NCD Alliance, for a conversation about the next phase of global NCD advocacy and action with Maggie Lake.
All right, hi. Thanks, Katie, for being here. So you have been advocating, and the Alliance has been advocating for 16 years. So much has happened. Just talk to me a little bit about how it's evolved and the changes you've seen in civil society.
Sure. Well, first, thank you for the invitation. Great to be here with everyone. I mean, I think the face, the strength, the size of civil society over the last 16 years has changed dramatically. I mean, if you think back 16 years ago when the NCD Alliance was being formed, very strong civil society groups across different diseases, different risk factors. But at that point, there was very little collaboration across the community. At that point, obviously, the NCD Alliance was formed, and we really kind of got behind this shared agenda of common risk factors, common health system solutions. And since then, things have evolved and rapidly kind of strengthened in many different countries and regions. Over the last 10 years, we've seen almost doubling of the number of national and regional NCD alliances around the world. So we now have 72 national and regional NCD alliances. I think another thing that's really changed in the civil society movement is a shift from the critical importance of professional societies, which still remains the same, but also adding to that the community voice. I think Diana said it so well earlier in terms of lived experience, the patient voice, as well as youth advocacy, really kind of coming to the table and demanding further action and making it so much more people-centred. And I think also over the last 16 years, the actual role and recognition of the role of civil society has changed. I said this last night at our event on community engagement. 16 years ago, we were talking about and kind of justifying the role of civil society for so long. This is what we're here for. This is why we're at the table. And now that's very much recognised in terms of our role on awareness raising, advocacy, service delivery in terms of improving access, as well as obviously the critical role of accountability. So everything has significantly changed in the last 16 years, I'd say.
Yeah, we just came off the technology conversation, obviously. And, when you first started out, we barely had social media, right? All of the tools that we now have to sort of galvanize people behind this. As we, the point of most of these conversations and for the gatherings this week is to sort of prepare for the high-level meetings. How has your strategy shifted, or has it? In what way? And how have those high-level meetings informed this conversation? How are you strategizing differently around them? And what are your expectations as we head into the September meeting?
Sure. So, NCD Alliance was set up to call for that first high-level meeting in 2011, of course. So it's always been, and it continues to be, a key part of our advocacy strategy. I think others have already said it well today. The rationale for why high-level meetings are important are very clear. This is about heads of government, heads of state. This takes it from being a technical issue to being a political issue. It obviously is an opportunity for governments, as the ambassador said earlier, to kind of come together and build consensus around the commitments going forward for action. And obviously the most important thing about high-level meetings is how they translate down to the national and regional level to really ensure that you have leadership from governments. But the other way that we've always approached high-level meetings, and that continues to stay the same, is that, yes, the political declaration is absolutely key, and we've all got our eye on the political declaration, of course. That's the official kind of formal outcome of this process. But it's the whole ripple effect of high-level meetings that is why it's so important, because it essentially means, every government around the world for 12 to 18 months are focusing on NCDs and mental health. Every single government and every civil society organisation around the world has that chance to be engaging with governments and putting it on the agenda. So process as important as the outcome, I think my message is. And then in terms of the second question about, how high-level meetings have really translated into kind of building momentum around NCDs, you can point to so many examples of, at the global level, how those high-level meetings have accelerated the NCD response. The first one resulted in the set of global targets that we're all focusing on still today, 2025 targets. It also resulted in the build-up towards the Sustainable Development Goals. If we hadn't had those high-level meetings before 2015 and the SDG review, the SDGs, it's questionable whether NCDs would have made it into the Sustainable Development Goals, as well as all of the kind of collaboration and coordination that's happened since, including across the whole UN system, because if you think back 15 years ago, it was WHO who was pushing the NCD agenda, very little engagement from the broader UN system. And today we've got, UNICEF, UNFPA, UN Women, the United Environment Programme. You've got so many different United Nations agencies and programmes who are really focusing on NCDs. So they can have an impact, but equally, as we've heard already today from many of the panelists, the landscape for this one is tough.
Yeah, it's challenging. But I think that's a really important point you just made, because it's easy to forget. It feels like that language has been around forever, but it hasn't. And it feeds through. I talk to companies all the time, and in their quarterly reports, something as simple as that, having a framework for the conversation and the fact that NCDs are in that is incredibly important. So thank you for bringing that up. So against this challenging backdrop, I think it's really important to talk about successes and wins and how they can be scaled and pulled forward, as well as the challenges. So let's start with the wins first. What do you feel are some of the biggest accomplishments? And can we take that and build on that? I think Caroline made a great point. We don't always have to start from scratch, right? We've got some progress. How do we bring that back into focus and maybe build from there?
Yeah, and I think, I mean, this is another point that we were discussing at our event last night. I think it's really important that we are celebrating the successes in NCDs. We often talk about the challenges, many challenges, let's not lie. But equally, I'm very optimistic that there have been a lot of successes and wins over the years. To give a few examples, you know, we've clearly got strong evidence around what works in terms of NCDs. We have the best buys, both on prevention as well as treatment. So in terms of what governments can do, we have those cost-effective solutions at our fingertips, and we know what works in NCDs. We didn't have that 15 years ago, let's be honest. We've also got a whole array of new global action plans, targets, strategies around the specific diseases and risk factors, which are building so much momentum around cervical cancer, obesity, diabetes, hypertension, you name it. We've now got really strong strategies, targets, technical packages that all governments have at their fingertips to be implementing. Of course, we've heard already from other panelists around the transformation that's happening in access to care, taking care to people, to communities, to people's households. One of the good things that came out of COVID, I would say. You know, but obviously a long way to go. And obviously, you know, in NCDs, we need to obviously focus on the care and health system side of things. But we also always need to look upstream at the primary prevention side of the agenda as well. And I think over the last 15, 16 years, we've seen really impressive ways that governments are putting their neck on the line, fighting back against unhealthy commodity industries, to actually put in place policies that are making environments more healthy in terms of increasing taxes, front-of-pack labelling, marketing restrictions, all of that good stuff that we know works from a public health perspective.
So let's jump to the challenge, and let's end with a call to action. What would you like the focus to be? Because there are many, as we heard from the other panels. But what is your call to action as we head into that September meeting?
I think everyone in this room has heard our call to action a few times, but as one of my colleagues said earlier, you need to say it 21 times in order for people to really hear it. So I'll say it again. NCD Alliance set out last year, it was a long time ago, our priorities for this high-level meeting. And we have 5, and they very much resonate with a lot of the points that other panelists have already made. You know, first and foremost, this high-level meeting has got to be about implementation, as the ambassador was saying earlier, and those first panelists were saying. It's been a policy success, but an implementation failure. So in terms of your point about how our strategy has evolved, those first high-level meetings were about getting commitments. This one has to be about actually moving the needle on implementation and focusing on what works in terms of NCDs. The second one, which resonates with the previous panel, is unsurprisingly around financing and investment. I mean, we're obviously facing a very difficult landscape in terms of financing, but we've absolutely got to keep pushing this agenda forward because there's been so little funding in NCDs over the years. And so, you know, things like real focus on domestic resource mobilization, as well as public-private partnerships, but also really trying to use this high-level meeting to focus the community around targets for financing, because unless we've got targets, we're kind of shooting in the dark around actually what's needed. The third one is around breaking down silos. So again, you know, using this high-level meeting as an opportunity, not just to put a spotlight on the NCD response, but also to be linking it to that broader global health and development agenda, universal health coverage, humanitarian settings, food systems, so many linkages across sustainable development. I've lost track of what number.
Well, that's okay, because we're almost out of time, and jobs, I'll throw that one in too. But we know that if you can address those fundamentals, you can often check many boxes, which I think is why it's important for this to be part of the larger SDG conversation. And I'm glad you highlighted the progress, because it's easy to forget that when we're talking about the challenges. But everyone needs to stay motivated, because a lot has happened. And as we heard from the ambassador in the beginning, I think there's a lot of dedication that it will continue. Katie, thank you so much, not just for tonight, but for all the work you've done. Thank you so much.
Please welcome David Reddy, the Director General of the International Federation of Pharmaceutical Manufacturers and Associations, to share his final thoughts with Foreign Policy's Andrew Sollinger.
excellent discussions. David, thanks so much for joining us to wrap up a lot of what we've talked about today and come away with some high points. It would be great to get your takes on that. We've heard some really powerful perspectives. We've heard it from people living with NCDs, from very smart diplomats, from folks in business, partners who play in the space, civil society leaders as well just now. What stood out most to you from these discussions, and what resonated for you?
We just firstly, look, thank you very much for organizing this, and for it's a pleasure to be here with you all tonight. What stood out to me, I think, was just firstly looking at the breadth of speakers, and then just reflecting on the fact that, if anything, NCDs is something that's common to all of us in terms of the challenges that we will ultimately face. And it's something that really unites us all. And so just that, I think seeing the partnerships, seeing the way that people are beginning to think in a systems-wide manner, and kind of bring efforts together. I think NCDs, they're hitting earlier, they're hitting all sections of society, all socioeconomic groups, and across all geographies. And it's going to cost us about $2 trillion a year if, we don't get this right. That will continue. So I had some reflections on what needs to be done, and I made some notes as I was listening to the speakers today. So one of the things that really came out was moving from a reactive approach to a preventive approach. And what I heard discussed was 2 layers of prevention. And so the first is really the environmental, the lifestyle changes that can impact really positively in terms of reducing the burden of NCDs. And we were just discussing before we came in here, generally you hope that your kids follow in your footsteps. And I wish I'd followed in my kids' footsteps, because they don't smoke, they don't drink. They're actually, leading far more healthy lives than we did, although they face other challenges, I think, mental health challenges, which we could discuss more. So I think prevention is important. Also, the role of vaccines here has been really underestimated, and I may speak about, depending upon how this discussion goes, that a little more later on. The other type of prevention is secondary prevention, and a couple of the speakers mentioned this as well, and that is that, if we're able to screen, detect, and begin treating earlier, we can actually prevent the onset of serious disease, or at least delay it, and that can have a profound impact both for patients and also for society and for our economies. So I think that's a really critical area. Critical takeaway message from this is the whole paradigm of moving to earlier.
Shashank was just talking about that, the importance of primary care, how holistic primary care can play a role here.
Absolutely. And so I think that, if we can begin to look at that, so it goes from diet, from lifestyle, all the way through to, vaccination, and then screening and early intervention. So it is a holistic approach. We heard about what the industry can contribute, and I took away 2 things, and I also wrote down some facts and figures. So, one of the things is the pace of innovation has really increased recently, and just to put figures on this, 1,400 new medicines introduced in the last 10 years. So this is really unprecedented. Really novel approaches to managing diabetes, obesity, and also mental health disorders, Alzheimer's, for example. So we're really seeing breakthroughs coming through here. And in terms of the potential, there's 9,600 medicines currently in the pipeline in clinical development for NCDs. So this represents 75% of the overall drug pipeline. So the potential is huge. Now, listening to some of the speakers, and I think John in particular brought this out, that innovation is great, but really the innovation, these aren't medicines until they get to the patients that need them. And so the way that we're looking at that journey, that patient journey, and how we can impact that at different points to ensure that they get maximally beneficial health care. And I think one of the things that I found most encouraging, I know that there are partnerships that are working on this right now. Industry's engaged in about 150 partnerships across 100 countries with 40 different non-industry partners working with us. But then what you heard was companies are actually beginning to come together as well and are working together. And he mentioned that 4-company collaboration. And you heard both Caroline and John mentioning Tanzania, and that they'd recently travelled there. So I think coming together, that was another message I took away from this, that cross-sectoral partnerships, but the collaboration within sector itself is really beneficial.
I wanted to ask about that. I'm glad you brought that up, multi-sectoral partnerships. I mean, it's very clear this is not going to be solved, and we're not going to be able to move forward with independent movements. Cross-sectoral, multi-sectoral partnerships are key. How can they be structured to move into action, from commitment to action? What are some of the measurable on-the-ground impacts we can start looking at?
Okay, so I think you've answered half the question here already, and that is, what gets measured gets done. And so there's a report came out from the Access to Medicines Foundation, and it listed most of the major multinational companies that are involved in NCDs, and what really struck me was all of them are setting targets for the number of patients they want to reach in LMICs, and different metrics from company to company, but it's all very concrete and very tangible. And I have to say, John, I was talking to your CEO about a week ago, and those figures that you mentioned in terms of some of the targets that you as a company have, they were emblazoned across his mind as well, because he repeated those. And this was in a very general discussion. But what I saw was a real sense of urgency to achieving these, and I see that across many different companies. So I think what gets measured gets done. I think that also underscores the importance of a political declaration that is concrete and really sets out objectives, because what we need to do is we do need to make sure that we are measuring and tracking towards impact that is going to change the way the vision we have for managing NCDs and mental health.
This comes back, of course, to the Secretary General's point that we had a policy win, but an implementation deficit.
Yeah.
How can we make ourselves more accountable to results in this way? Measuring and getting the data is one thing, failing or succeeding rather than failing is another.
So I think there's another element of partnerships. So for this to work, you need partners that are committed, and the types of partnerships you're looking for are ones that are built on a respectful sort of relationship where you acknowledge the needs of the various partners and what they are able to contribute within this, and that's successfully leveraged around common goals. Because if you have common goals and you're all working in step, the likelihood that you will actually achieve this is far greater. So again, underscoring another important principle of the declaration, common goals within this, and then accountability. I think from an industry point of view, from what we've looked at is we've looked at 4 key elements to kind of what it's going to take and what this should embrace. And I think one is just ensuring that we support innovation. We have an innovation friendly environment. I think the next is a very strong focus on implementation. And that includes the type of measurement that we've been talking about. And then, I think just the whole notion of accountability here. And that's, I think, for every different actor within this, if you're contributing, you should be able to measure your contribution. It gets back to what I was saying about industry, just that ability to measure, track, and pursue it relentlessly.
Wonderful. We're almost out of time, but in the minute that we have left, we have an important meeting tomorrow, a high-level meeting in September. What's one action that the folks that are going into those meetings could take as a result? What would those be? What's one action they should take as a result from those discussions that you think would be a win?
I think it's around the commitment. I mean, innovation and access go hand in hand. So this isn't just about the next generation of medicines. Yes, that's part of it, but it's about facilitating access to those. So we need to think in an integrated way and solve the various challenges that go along that value chain, including financing, which is going to be even more pressing as we move ahead. So this is about commitment. It's about ensuring that we set goals, And it's about ensuring that the finances are there to sustain this.
Okay, great. Well, I want to once again thank you, IFPMA, for helping to support this discussion. I feel like FP can play a role in galvanizing those partnerships as well.
Thank you.
Our pleasure. But thank you so much for joining us and for giving us this wrap up. I appreciate it. David Reddy, IFPMA. That works too. Well, that brings us to the end of our discussion. Thank you so much for being such a great and patient audience and for finding us here. We really appreciate that. We couldn't do it without you here. And for those of you watching online as well. Just want to remind you, on the back of your card there with the agenda is your subscribe to FP card. Make sure you flip that over and zap it. We'd love your support and great content all at the same time. You can also look for an excellent body of research that we produce at FP Analytics, our in-house research think tank, which you can also find on our site. I wanted to give a shout out to our events team that does a fantastic job and pulled this program together. They will be producing another program later on this month. We're in May now, right? In Geneva at the WHA. It's the Global Health Forum that FP produces there each year. If you're going to be in Geneva, please do join us. And you can find that on our homepage as well. And then lastly, we will produce very good health programming in New York here in September on the back of the high-level meetings. Our Global Health Forum at UNGA, which will take place in Rockefeller Center, a little bit more centrally located. And as part of that program, we will also be doing an NCD simulation where participants will sit around the table and they will actually game out what happens in a scenario that our research team will develop. If you're interested in that program, my colleague Zach Pogofsky, who's standing conveniently over there in the corner, can help chat with you about that. We're looking for partners to work with us on that simulation, and we welcome your support. Thank you for your time. Drinks are being served outside. Please join us and enjoy. Thank you.